The birth of a baby is always a miracle. But today, these newborns are contributing to more and more miraculous medical breakthroughs. Umbilical cord blood, something that is normally thrown out after birth, is now being captured, stored, and used to treat a growing number of diseases that were considered untreatable. It's something we call the second miracle. Mary McGuire of Lowell, Massachusetts, has just delivered her own miracle, baby boy Damien.
I've never been able to have a baby. There's been problems for a long time. I mean, I buried a daughter 10 years ago, you know, and I was pretty much told that I'll never be able to carry a baby full term. It was just never going to happen. And then when I found out I was 5 weeks pregnant and I was actually that far along and didn't realize it, I don't know, I just knew it was going to work. Something told me that everything's going to be all right. I don't have to worry about it.
Mary suffers from a chronic and debilitating blood disease.
What are the symptoms of this? What happens to you?
I just feel sick all the time, like your flu symptoms. That's what I have. It's normal to me. Like I'm tired all the time. Your common cold lasts you a couple days. It lasts me a few weeks. Sometimes, a lot of the times I get hospitalized because of it.
So Walter, tell me about your daughter's prognosis.
MDS is what they're calling it, myelodysplasia syndrome, and I think that's just a generic term of the condition.
Pre-leukemia.
Yeah, it's pre-leukemia. She's been close to death from different infections in the past, so she has to be extremely careful.
Myelodysplasia is a chronic blood disease which results in anemia and disturbed production of white cells and platelets.
Dr. Hans Klingemann is Director of Bone Marrow and Hematopoietic Cell Transplantation at Tufts Medical Center.
There is no cure except a stem cell transplant, basically replacing the diseased stem cells with a new stem cell source.
For most of us, the term stem cell evokes controversy or confusion. In fact, stem cell research is one of the most revolutionary and promising areas of biology. Some people might be confused between umbilical cord blood stem cells and embryonic cord blood stem cells. Could you straighten us out on that?
Yeah, these are two different stem cells.
So when we talk about cord blood stem cells, we are not talking about embryonic stem cells.
It has absolutely nothing to do with embryonic stem cells. These are mature cells which are collected from the cord after delivery, and again have nothing to do with embryonic stem cells.
Stem cells are the mother of all cells, capable of creating the major components of human blood, the immune system, the bone marrow. As the stem cell develops and matures, it grows into red cells, white cells, or platelets. The miracle of the stem cell is that it can develop all these different kinds of cells as needed, sort of an internal repair system. That system has never worked for Mary McGuire.
How they told me one time is that I have the immune system of an AIDS patient.
Dr. Klingemann explains the options for Mary's stem cell transplant.
We try to use bone marrow, but in many situations we cannot identify a suitable bone marrow or peripheral blood stem cell unit for a patient. And in this case, we explore the option of cord blood.
The umbilical cord is the lifeline connecting the fetus and mother from about the 6th week of pregnancy till birth. It supplies oxygen, nutrition, and a means of waste elimination while the baby is in the womb. Once the baby is born, the cord is thrown away. Right now, 95% of all umbilical cords are discarded. That is a waste that the New England Cord Blood Bank wants to stop. We'll be right back. Umbilical cord blood is blood that remains in the placenta after the baby is born. It is no longer needed by baby or mother and is rich in stem cells that, when used in transplants, can treat as many as 80 diseases, including Mary McGuire's myelodysplasia.
Myelodysplasia can be cured by a stem cell transplant, and on average I would say that 30 to 40% of all patients are cured. In some cases, depending on the age and the risk factors, actually these numbers look even better.
So Walter, how did you hear about this idea of umbilical cord blood transfusions?
Actually, it came fairly recent. It was Dr. Kenneth Miller at Tufts is Mary's oncologist, hematologist. But when she became pregnant, he talked about using cord blood. And they gave Mary a list of websites to go home and try to find somebody that would capture the blood and store it, which I've never heard of, and she had no clue what they were talking about. So she read the list over the phone to me, and I wrote them down and started doing some research on it.
Walter McGuire's online research brought him here to the website of the New England Cord Blood Bank, a longtime leader in the cryogenics industry and a family-owned business.
We thought that the use of umbilical cord blood stem cells would be a good addition to what we did, because our main focus is cryogenics, and that's of course the extreme low freezing of cells and tissue. And umbilical cord blood stem cells, being tissue, have to be held at extreme low temperatures. We were one of the first to get involved in this. The quality behind it really is in the processing and freezing of the cells, and that's been our business. Nobody has the length of time in cryogenics that we do. We're a leader in the industry. So we did some research. It actually, our R&D took about 2 years on how to separate the cells and how do we get them out of the blood, etc. Because it was relatively new and there was very little known about it.
Cord blood banking begins with the collection process at birth. It is done right in the delivery room and is painless, simple, and safe.
The postpartum event is the expulsion of the placenta, and that's the critical part with cord blood. We have a collection team that will take that placenta, they will insert a needle, and they will allow that blood to drain into a sterile collection bag. That cord blood is processed, and then a cryopreservation agent is added to that, and then ultimately that blood is stored under extremely cold conditions under liquid nitrogen.
In the cryopreservation side, after these stem cells are separated, they're introduced to a computerized controlled rate freezing system. It's all about ice. If we have sharp, jagged ice crystals in the freezing process, these ice crystals literally just puncture the cell membrane, and that cell dies. So what we do is we add a little cryoprotectant at that point and transfer them to our liquid nitrogen storage facility.
What about the potential problem of keeping blood in a bank for a long period of time? Is there the danger that it could lose some of its potency?
The data indicates up to 15 to 20 years that these cells are still viable following this type of long-term storage.
Still, life offers no guarantees. Unfortunately, when Mary McGuire's son Damien was born, not enough umbilical cord blood was captured.
And then we mentioned that Kimberly was pregnant, and Dr. David talked to his team and called us back and said, absolutely, approach them and see if they're willing to donate, because it would probably be a much closer match than anybody else in the world. So,
Kim McGuire is married to Mary's brother Andrew. They're now expecting their 4th child.
I wouldn't change it for the world, to save our life, It's great. Feel lucky to do it. Feel like, I don't know, the chosen one.
The birth of Kim's baby girl, Aubrey Rose, gives doctors a chance, albeit small, of a matching cord blood. If there is not a match, Dr. Matsilovich says there are still other options.
We can go into the public domain for cord blood, and we can identify a publicly donated unit. We could do this in combination with her own child's unit if there is a sufficient HLA match, meaning she will not run the risk of her own immune system rejecting the stem cells that are introduced into her bone marrow. So what we can do is find a very good match, and when the transplant team is ready, that unit will be delivered to the hospital where the transplant physicians will perform the bone marrow replacement.
Why did you choose to follow through with Mary McGuire's case?
Wow. We've done this in the past as well. Every once in a while, there is a case that we just cannot walk away from. This individual has a very serious hematological disorder myelodysplastic syndrome. So we are working with this family in any way possible to ensure that she receives a cord blood unit that ultimately can contribute to her overcoming this very serious disorder.
But doctor, this is a business, so how can you afford to do that at all?
Of course it's a business. That's why, as a business, we have a moral and ethical duty to assist some of these individuals that have these very serious disorders that are readily treatable with cord blood stem cells.
I think what differentiates us from other companies would be that we're a local New England company. We do everything right here in Boston. We have our processing lab here. We have our storage facilities here. Everything's all done locally. We try to take care of our local customers in a really special way. We have a courier that goes to pick up their blood when their babies are delivered, things like that.
Mary McGuire is waiting to hear about the next step toward her stem cell transplant. She is still very sick, but more confident now that she has a new group of advocates at the New England Cord Blood Bank.
I'm glad that they did this pro bono for me because it's probably going to save my life, and I mean, instead of having a few years with my son, I could watch him grow and graduate from high school and get married and, graduate from college rather than see him hit kindergarten and that's it.
The New England Cord Blood Bank is a private business that has stored more than 100,000 cryopreserved tissue and cell specimens in its Newton facilities. The initial fees for the storage of cord blood run just under $2,000.
Once the processing fee is taken care of, there's only an annual storage fee, which is relatively inexpensive compared to today's prices for anything.
Let's talk about the differences between private and public cord blood. What's the difference between the two?
Okay, first of all, in the public sector, the mother will allow that cord blood to be collected, processed, and stored. That will either go for research purposes to scientists, or it'll go into a public bank, like the bone marrow registry. In the public bank, the family who donated that cord blood unit has no control over that unit. Chances are it'll be used for an individual they don't know. It could be used anywhere in the world. In private banking, the family has full control over that cord blood unit.
According to the American Academy of Pediatrics, there's a less than 1% chance that a child will need his or her own cord blood stem cells in the future. So why then bank it with you?
Well, that's a good question, and it comes down to a matter of statistics and how the statistics are used. Estimates range from anywhere from a 1 in 2,000 to a 1 to 20,000 chance that an individual could utilize their own stem cells for a treatment. However, in private banking, we're not just talking about an autologous use or a self-use. We're also talking of the potential for these cells to be used to treat a sibling or even one of their parents.
So you think it's worth it even if it's a small percentage?
Absolutely.
The line for much photos. It was like an hour, Kaylee. Did you see it?
Lori Tuitt, who lives in Wahiawa, Hawaii, decided to use New England Cord Blood Bank services 7 years ago.
Basically, I knew about cord blood banking because I'm a registered nurse. When I was pregnant with my second daughter, who's Madeline, I had received a piece of paper from the hospital about it. So then I started to look into it. I really researched it online. I thought of, I also had a friend at the time whose daughter had leukemia, and so I learned about it through that. I started researching all different banks. Then we decided that we were going to choose the New England Cord Blood Bank, and we went from there. I remember that initial fee was hard for us, but like I said, I just kept looking. I just felt a gut instinct to do it.
I appreciate the assistance that the Cord Blood Bank has been giving us so far. The excitement behind it, I think, is very important, because I think what they're doing and what they're trying to do, and I understand that it's a business, but it's a business that is trying to further science, trying to further the the opportunities to people. And when I think about the cost that it's cost us over the years, truly it was minimal.
Lori and her husband Jim had no way of knowing when they had their daughter's cord blood stored that Madeline would develop medical problems.
When she was about, I would say, 6 months old, was when we started to notice that she had a lot of problems with coordinating her movements, like she couldn't transfer a toy from hand to hand. She has what's called ataxic cerebral palsy, so she has a lack of balance, coordination, and she has a speech issue.
Bucket of water. I need to put.
Cerebral palsy is believed to be the result of a brain injury that occurs before, during, or shortly after birth.
Just recently she started asking us why her body doesn't do what she wants it to do. So that's really hard. It's a hard question to answer. You know, I said to her, because God made you special. And she said, special with no balance? That's what she said to me, as if she doesn't believe how that could be special. Why don't I have balance? I mean, that's what she wants to know, why, you know. And when kids ask her, what's wrong with you? She'll say, I'm just working on my balance. I'm finding my balance. That's what she says. That sounds so new age, like as if, you know, she's like yoga or something, but she always says, I'm finding my balance. She's working on it. She knows she's working on it, but it's a very frustrating process, even for her, you know, at just 7 years old.
While several therapies are available for the treatment of cerebral palsy, doctors say there's no possibility for a cure, up till now.
So I'm cautiously optimistic, and only because I don't want to give people false hope.
Dr. Joanne Kurtzberg, director of the Pediatric Blood and Marrow Transplant Program at Duke University Medical Center, is the preeminent authority on cord blood transplants in this country. She is now conducting cord blood transplant trials on cerebral palsy patients.
You know, we're in the very earliest phases of clinical trials using cells to treat patients with cerebral palsy. Here at Duke, we're testing whether it's feasible to give children their own cord blood cells that might have been banked at the time they were born back as an intravenous infusion. And we're looking to see if doing that lessens the symptoms of cerebral palsy.
The Tuitts have signed up Madeline to participate in the Duke trials this winter.
When I first found out that people were doing this, to me that was just, it was just amazing. I mean, it was just such a moment. And my husband, who was, you know, in Iraq, I sent him the information, and he told me he was reading it over his computer just with tears running down his face, because it's, you know, we're so lucky that we saved it.
When I received the email from Lori about the possible transfusion at Duke, the first thing that struck me was the incredible amount of hope from Madeline. That this is an opportunity that could bring about the possibility of major change and improvement in Madeline's life. And because of that, I was overwhelmed with emotion.
We don't understand enough about timing. We think, because of treatment we've done with children with genetic diseases of the brain, that the closer you are to the time the brain is injured, the better chance you have for the cells to make a difference.
So what advice do you have for parents out there who have a child with cerebral palsy? What should they be doing now?
Well, I would say that I would be hopeful that therapies are coming, and that I believe that cells will be part of those therapies. But I would also caution them to say they're not here right this minute today. And although we all wish we could just prevent this or cure all of these children right now, we're not at the point where we can do that. But I wouldn't be doing it if I didn't believe it had great potential to help in the long run. If they've saved their child's cord blood, then they should contact us to see if there's enough cord blood to consider them as a study candidate for the trial.
We'll be right back. Scientists at New England Cord Blood Bank believe the 80 different diseases now being treated with cord blood stem cells are just the beginning.
Where do you see the future of cord blood banking?
They're using stem cells in some very aggressive diabetes research, which I would not be surprised in the next few years there's an announced cure for diabetes using stem cells.
I collaborate with stem cell experts all around the world. We're looking at improving the current uses of stem cell transplants, but we're also very actively pursuing future uses. I mean, we're going into areas that are just amazing. Down the road, we're going to be growing bone for maybe facial reconstructions or jaw replacements.
The demand for cord blood stem cells is expected to increase dramatically. Dr. Joanne Kurtzberg has successfully pushed for federal legislation to support more public cord blood banking.
There's going to be a program called sibling banking, which will enable families who already have a disease or know they carry a disease that can be transplanted to take cord blood from any babies born into their families subsequently, and to have those cord bloods stored in one of the public banks.
Dr. David Matsilovich believes there is value in both public and private facilities.
Both are critical because there's an urgent need for cord blood stem cell units to be used for transplant. You have so much diversity that it's so hard to find, say, an identical bone marrow unit that they could use for a transplant.
Keon Penn of Atlanta, Georgia, was the first sickle cell patient to receive a cord blood transplant. His disease was cured.
In sickle cell, when you do a transplant, you give the patient chemotherapy to kill their own bone marrow, so they're not making these abnormal red cells anymore, and also to prevent their body from rejecting donor cells. And then you transplant them, which is just an infusion in the blood, with donor cells that don't have sickle cell and match closely enough to grow in their body. A month or so later, if things go well, the donor cells start growing. They make healthy red cells, and the sickle cell is cured.
And it would be even better if we can get him involved.
Michelle Barzy is a volunteer at the Greater Boston Sickle Cell Disease Association.
Looking back now, I saw that I had a different and difficult life because I was always different from the other children, and I spent most of my time in the hospital. I did hear a little bit about cord blood transplant. So for patients who have sickle cell and may be cured for the future, that's great, because I wouldn't want to see anybody struggle like patients like myself and others.
It seems like we could use the word miracle when it comes to using cord blood for sickle cell treatment. It does cure, correct?
Yes, cord blood cures sickle cell. And that's been proven, studied, published, and become the standard of care.
There is a lot to learn about cord blood banking. When should you make the decision? New England Cord Blood Bank suggests it's best to decide as early in your pregnancy as possible. Having the collection kit early can lower your anxiety. What happens if you deliver early and you haven't received the kit? New England Cord Blood Bank will fax or email detailed instructions to your delivering doctor. New England Cord Blood Bank can answer all of your questions and will take you through its simple process step by step. Once you've enrolled, you will receive the collection kit with everything you need for the hospital. You'll want to pack the kit along with the other things you'll take to the hospital, and be sure to let your doctor or midwife know at your next prenatal visit that you plan to bank your baby's cord blood. When the baby is born and your medical team collects the cord blood, call your selected courier. The blood will be picked up and delivered overnight to the cord blood bank, where it will be processed, tested, and stored. As soon as the cord blood bank receives the blood, they will call you to confirm its arrival and begin processing it immediately. After processing, a written lab report is sent to your home, detailing the number of stem cells preserved and informing you that your baby's cord blood is stored securely in the bank's cryogenic storage facility. Then you can enjoy your baby with the knowledge that the cord blood is available to you at any time in the future should you need it.
For answers to any of the questions you may have about cord blood banking, log on to www.cordbloodbank.com. And remember, if you're expecting a baby, that umbilical cord blood is the second miracle. I'm Liz Walker. Thanks for joining us.